Bonsoir, bonsoir à tous et à toutes.
Good evening,
Chères madame, chers
everybody,
participants
ladies
et
and gentlemen,
participantes,
dear participants.
au nom du directeur pays de Pathfinder,
In the name of the
Monsieur
country director
Dr
of Pathfinder,
Bunuki,
Dona
nous
Bunuki,
avons le plaisir
it is our
et l'honneur de vous
pleasure and the
souhaiter la
honor
bienvenue
to welcome you
à ce webinaire.
to this webinar.
Votre présence aujourd'hui témoigne de votre engagement
So
et
your
votre
presence
volonté
today
de faire face aux
shows
défis de société qui touchent
your commitment facing the challenges that we're all facing together.
Alors, avant de rentrer dans le vif du sujet,
Before delving
dont le thème
into the
principal de ce
subject matter,
webinaire, c'est
the
le renforcement
topic
de la qualité
today
de l'offre de
is the
soins
strengthening
dans
of
les
the
endroits
quality
à
of
fort risque
healthcare
sécuritaire.
provision in
Donc,
areas of
notamment en vue du
significant
partage
security
d'expériences en matière de
challenges.
tutorat clinique et de la
And we're
supervision
going to share
délocalisée
a case
et de
study, which is the clinical
l'expérience implémentée
mentoring
par
mentor
Pathfinder.
mentee, which was
Nous allons
implemented
vous
by
demander,
Pathfinder.
chers participants et participantes,
We
de
will
cliquer
ask
juste
you,
en bas du
dear
webinaire
participants,
aura une interprétation en anglais et en français.
to
Donc,
choose
je vais
the
demander
language in
à
which
tous
you wish
les
to
participants
listen to
qui sont
this
connectés
webinar.
d'aller juste en
So,
bas de
all
votre
participants,
écran. Vous allez
please
voir
go to the bottom of
comme
your
une flèche qui
page,
s'est mise
click on
interprétation.
more,
Donc,
and you will
cliquez
click on the
là-bas et
globe, and then you will
sélectionnez le
see
canal français
interpretation.
pour pouvoir
You
permettre
will,
au service de la traduction de
for
pouvoir
those who want to listen in
délivrer le
French, click
message
in French,
conformément
and those
aux
who want to
instructions
listen in English,
que
the
supposées
English
dans les quelques
interpretation will
minutes.
be available.
Donc,
So
euh,
please,
je répète,
let me
en bas de
repeat,
votre écran, vous
at the
allez
bottom
voir
of your
l'icône
screen,
où c'est écrit
you're going to see an
interprétation. Donc, cliquez
icon
sur
that
le
says
globe.
more with the
Donc, si
globe
vous cliquez
that
sur
says
cela, vous allez voir
interpretation. And if you click,
français,
you can
anglais.
choose
Donc,
the
je vous
language in
demande
which
à
you
sélectionner
wish to
l'icône
listen to
français
this
pour
webinar.
permettre au service de traduction de pouvoir
So for those who want
nous
to
afficher cette
listen in
message.
French, click on French. And for those who want to listen in English, click on English.
OK. Merci à tous pour
That being
cela.
said, thank you very
Alors, donc
much.
aujourd'hui, nous avons le plaisir, en tout cas, d'accueillir
Today,
des
it is our
personnes
pleasure to welcome
pour
our
l'animation de
panelists
ce webinaire. Et la
who
première
are going to
personnalité
participate in this webinar.
que je
The
souhaite vous
first person
présenter
that I'm
est
going to
celui qui va
introduce,
assurer la police
and he's going to be the
de ce webinaire
moderator
tout au long.
of this
C'est
webinar.
la personne de Dr Moussa
His
Diodori.
name is Dr.
Alors,
Moussa Djadjori.
c'est un médecin de santé publique
He
qui a plus
is
de
a public health
33 ans d'expérience
physician
professionnelle
with over
dans le
33
système de
years of
santé
professional
burkinabé.
experience
Donc,
in
il a
the
aussi
Burkina
plusieurs postes
Faso
de
healthcare.
responsabilité stratégique
So he held
parmi
strategic
tant d'autres postes
positions,
que
including
notamment le chef de service de la santé de la femme,
head of
de l'homme
Department
et
of
des personnes
Women's,
âgées au
Men and
ministère de la Santé
Elderly
publique et de
Health at the
l'hygiène.
Ministry of Health
Par ailleurs, il a
since
également été chargé du
2016.
programme
He's
maternité
also been in
infantile,
charge of the maternal
coordinateur
health
national de
program,
lutte contre
national
le
coordinator
sexisme
for
et autres,
the fight
directeur
against
régional de la santé du Nord,
schistosomiosis,
médecin-chef
regional
du
director of
service
health
de la
for the
disponibilité
North,
de Saponnet et
and
de
chief
Zorgo.
district
Il a par
medical
ailleurs également
officer for
assumé des fonctions de
localities of
consultant à
Sepone
la
and
fois aux
Zorgo.
directions centraux
And he's also
comme au
acts as
ministère de la
a
Santé.
consultant
Son engagement est
for
vraiment illustré
the
au niveau
Ministry of
international
Health.
avec notamment
He's worked on an
le fait
international
qu'il a
scene as
assuré
well
en tant que représentant résident
as
de population media au Centre du
resident
Burkina Faso.
representative of the
Également,
Population
notre
Media
directeur
Center in
technique
Burkina
est également
Faso.
très bien connu sur le plan scientifique, avec
He's
plusieurs
also
études
very well known
publiées
on
dans les revues
on the
et des
scientific front.
participations à
He's
des comités
recognized
consulaires.
author with
En
several
témoigne
studies
également
published in
ses
scientific
divers
journals
ateliers en
and
2016
conferences
sur les questions de qualité des soins
talking
et
about
des services de
quality of
santé. Je
healthcare.
voudrais en tout cas demander à tous les participants de souhaiter
Please
chaleureusement à travers des likes et
uh,
des pouces la
join me
bienvenue
to
à notre
welcome
cher
him
modérateur du
very
jour.
warmly today.
Alors, comment la session va se dérouler à proprement
So,
parler?
what is our
Donc,
agenda is
déjà,
going to
on
look like
commence
today?
avec une session d'introduction
So, we're going to
par
start with an
rapport à ce
introduction of the
webinaire.
webinar.
Donc, ensuite,
We've just
le
introduced the
modérateur va
moderator.
prendre la
Then the
gestion du
moderator will
webinaire
take
et dire
over.
son mot de bienvenue et situer le
He's going
contexte
to
par rapport
wish
à ce
us
webinaire.
welcome
Ensuite,
and
suivra une
give you some
présentation de notre
orientation.
expert
Then we
panéliste
will
du
have a
jour, à la
presentation
personne
with
du
our
docteur Denis
expert,
Bouillini, donc qui va nous
Denis
assister sur les
Bouillini,
deux sujets capitaux du
who
jour.
is going
Et
to
ensuite,
talk
nous allons
about
recueillir des
our
témoignages des
topic.
bénéficiaires qui ont
Then
été
go on
acteurs
to testimonials
de mise
from
en
people
œuvre au
that
premier plan
benefited from
de
these
ces différentes
services.
interventions-là sur le terrain.
that benefited these interventions on the field. And after that, we will move on to the question and answer phase of our webinar with a conclusion and a summary. So let me just remind you again that the interpretation is available. And thank you for the global team, which helped us through this whole process. So please go to the interpretation channel at the bottom of the link. And if you want to hear it in French, click on French. If you want to hear it in English, click to English. Now we are going to give the floor to our moderator. Good morning, good afternoon, good evening, everybody. Thank you very much. Welcome to all of you. We are going to focus on the strengthening of quality of healthcare provision in areas of significant security challenges. Those are new, innovating challenges experimented by Pathfinder. And we are going to delve in the subject matter. As far as Burkina Faso goes, with the current issues, terrorism issues in Burkina Faso, some healthcare facilities can no longer work. We are moving populations. We need to find different strategies to provide quality healthcare. So mentoring already existed, meaning that a very experimented person would spend time with another person who was just qualified or just graduated and teach them. So in times of security challenges, it makes it particularly challenging to go in remote places. We also resorted to village midwives because some healthcare facilities don't work, and the populations who are in those areas must benefit to a minimal of healthcare. And that's why we selected women in the community that were trained to give birth in a secure way. We also developed a minimum setup of emergency, so especially when there's issues like terrorism, we are deploying these methods, and these methods we provide them ad minima. So Pathfinder found a strategy which is called a delocalized supervision, and the mentoring is difficult to implement. So what did Pathfinder do? They found an alternative, which is mentoring on site. So we are going to listen to our Pathfinder expert. His name is Beni Bonini, Dr. Beni Bonini. He is OBGYN. He worked at the local hospital, then the maternity ward in Gourou, where he was named in charge of reproductive health, and he now works for Pathfinder. So he's going to do two presentations. So first off, the clinical mentoring and delocalized supervision. So he has now the floor so that he can talk to us about these two very innovating approaches. Denis, you have the floor. Thank you, Dr. Dagwari. Thank you for your warm and modest introduction. It's a pleasure to be with you today and to share our approach to strengthen the quality of healthcare provision in areas of significant security challenges. Apparently, the terminology has changed. So we're talking now of areas of challenging access. So what do we want to do? We want to show the innovating process meaning the mentoring and also delocalized supervision.
Alors, pour ce qui est de la du tutorat
So let's give you a little bit of
clinique,
context.
dans quel contexte, bien sûr, cela a pu être mis en œuvre?
So what is the
Déjà,
context in which we
il faut
worked?
savoir que le projet Sauver la
From the
Vie est un projet
get-go,
qui vient en appui donc au ministère de la
it's a
Santé
project
pour
that aims at supporting the
accompagner à
Ministry
travers
of
donc,
Health
le renforcement du système de santé
to
de notre prochaine
strengthen
population. Alors, comme l'a dit la mère d'Alvari,
the health
déjà, le
system
ministère a
and
mis
to support populations.
en œuvre certaines stratégies, notamment le mentorat depuis 2013.
So
Ce
since
programme de mentorat est
this
accompagné
mentoring
par
program has been
plusieurs
implemented
partenaires comme
since
Pathfinder
in
International.
in
Bien sûr, avec
2013
la
with
situation
partnership of
sécuritaire
Pathfinder.
qui
And
prévaut
with
actuellement,
the
donc ces
security
derniers ne sont vraiment
challenges that we're
inaccessibles.
experiencing,
Nous
some
avons
areas
Pathfinder
are
qui
just not
fait le
accessible.
mentorat
So
autrement.
Pathfinder decided to
Appui
do
le tutorat
mentoring in a
clinique
different
aussi,
way.
ce modèle combine pédagogie,
This model
formation
combines
et socialisation entre les
pedagogy and
prestataires, sollicitant donc dans la même
socialization
zone et dans le même
on site in the same areas.
En définition, que pouvons-nous dire du
So as a
tutorat? Le tutoring
definition, what can we see?
l'ensemble des
Tutoring
activités mises en
is the
œuvre
set of activities carried
par des
out
professionnels en situation de travail
by
en
professionals
vue de contribuer à la
in the
production
workplace
ou à la
with a view to
transformation des
contributing to the
compétences professionnelles.
development or the
Cela voudrait
transformation of
dire
professional
de créer
skills.
une
What does that
relation
mean?
formative entre
We
un
want to create
professionnel plus
a
expérimenté
training
ou un apprenant
relationship
et un
between a
tuteur
more
et
experienced
un
and
apprenant ou une
professional
personne
and a
en
tutor
apprentissage
and a
de
mentee
tutorer
or a
ou
learner
encore de tutorer parce qu'il peut en être plusieurs. Le tuteur et le
or
tutoré
mentees.
résident tous dans la même
They both
formation sanitaire.
reside
Alors
in the
ici, je
same
vais faire un
health
petit
district.
détour sur ce tutorat en
So
disant
let me
qu'ici,
talk about
ça
this
vise
mentoring
essentiellement trois fonctions.
because
La
it
fonction
aims at
pédagogique
three
ici
functions.
concerne le tuteur qui en lui-même
So here,
va
the
donner des connaissances
mentor
à quelqu'un
is going
qui
to
est
provide
un agent
knowledge to
inférieur et
somebody
cela lui permettra lui-même de grandir.
who is an
La fonction
inferior in
managériale
hierarchy
avec
and
le
helps them
tutorat,
grow.
on arrive donc à perfectionner
So
l'organisation
we
des
managed
services
to
et également
perfect
au
the
côté
management
social.
of their
Il y a un
services.
lien
And
qui
from a
se crée
social
entre ces deux
perspective, there's a
personnes et également
link, there's a
entre eux et
bond
le
that gets
public.
created between both of them and the community. Next slide.
Alors, pour nous, qui peut être tuteur
Who
ou
can
qui peut
be
être
a
tutoré?
mentor or who can
Alors,
be a
notre système de
mentee?
santé, en tout cas, a plusieurs acteurs qui y participent. Mais
So
pour
there's
nous,
several players that could
pour
be
être
at play
tuteur, il faut
here,
déjà être
but to
quelqu'un qui
be a
exerce dans
mentor,
une maternité,
you
dans
have to
les
be a healthcare
centres de
worker
santé
specialized in
médico-social. C'est
obstetrics
notamment
and
le centre médical. D'abord, c'est
gynecological
les médecins,
care. So
les
first, a
attachés de santé en
doctor,
soins obstétricaux et néonataux et
so
gynécologiques, les
specialized
sages-femmes, les
midwives,
magnéticiens, les accoucheuses brevetées, les
certified
infirmiers
birth
quota. Et il
attendants,
faut
and
résider, comme je
registered
l'ai dit au début,
nurses.
dans la formation
So you
sanitaire
have to be
et être
residing
retenu comme
in this
formateur ou
healthcare
tuteur
facility
après
and
la formation des
area
formateurs. Il
and
fait
be
également
selected as a
participer
trainee
au cours.
mentee after
Déjà
the
arrivé au
training.
tutorat, on est passé par plusieurs étapes, dont
So
la
that
formation des
in
formateurs
summary, you
qui a
have to
pris
go
12
through
jours.
different
Et également
steps,
au cours de cette
12
formation, non seulement
days.
on donne le côté technique, mais
And so
également on
you're being
capacite
provided
ces
a
acteurs-là
technical
sur
aspect and
l'andragogie.
you
Et c'est ça
enable
qui
them
nous
to the
permet donc
andragogy,
d'aboutir au tutorat.
which brings
Alors, qui peut
us
être
to
tutoré?
tutoring.
C'est tout
Who
prestataire
can be a
intervenant
mentee?
dans les
Any
services de
provider
maternité.
working
Il
in the
faut également
maternity
avoir
service.
pris part à la formation sur
You
site,
have to
sur lequel je
be
reviendrai
part of
plus
an
tard.
on-site
Et au cours de cette
training.
formation, il faut avoir
And
donc
during
un
this
score qui est
training,
inférieur à
your
80%,
score
un score de compétence qui est
must
inférieur à
be
90%
above
pendant la formation.
90% during the entire
Également, au
training.
cours du suivi post-formation, un score également
And
inférieur à 90%,
post-training,
où tout prestataire intervenant dans les formations
any
sanitaires et
provider
qui
with
a
a
un besoin
competency
d'accompagnement
score
pour une pratique
over
clinique. Alors,
90%
je
during
parlais
the
tantôt du suivi
post-training
formation sur
follow-up.
site. Alors,
So
c'est un
I've been
complément à
talking
la
about
formation
training
des
on
des
site. It is a
formateurs
complement
qui, à l'issue
as
de leur
the other
formation, vont dans
training,
les différents districts forment à leur tour
which
donc
for
les
which
prestataires qui
you
sont
go
dans
on
les
different
formations sanitaires.
sites and
Et cette
help
formation également est
other
sanctionnée
people in the different
par un
areas.
score qui leur permet de les classer
And the score
en
will give you a
prestataires maîtrisant
ranking.
la technique avec un
So
score bien
first
sûr
off,
qui est supérieur à 90
so let's
par
say
exemple.
somebody
Pour un score qui
who
est
has a
compris entre
score
90 et 99,
higher
on dirait
than
que la personne
90,
est compétente. Et lorsque le score est inférieur à
and in
90,
below
la personne est
90 you're
considérée comme non
competent,
compétent
and below 70, you are non-competent and you're going back to mentee. So you can be competent, but if we think that you have a hard time applying what you've learned, that person will be reassessed and see how they can be supported for further training. Next slide. So how is this organized on a practical basis? So there's a testing of basic skills of service during on-site training, and this will give you a ranking of the providers. There's also an identification of service providers who need mentoring based on their scores in skill validation and post-training follow-up. There will be an interview with a mentee to determine areas for improvement and develop a mentoring plan. So if you experience challenges, we have to talk to them to understand what's going on, where the difficulties, where the challenges reside, and what we can do. So after the interview, they're going to be signing a mentoring agreement between the mentor, the mentee, and the district supervisor. And there will be support on 6 months with an intense phase of 3 months, with it extendable to 6 months. And at the end of the tutoring, there will be a report. So after the signature, it's going to take at least 6 consecutive months of follow-up with 3 months of intensive follow-up. And the mentoring visit will take place on a monthly basis for 3 days and according to the mentee's needs or the presence of clinical case on site. So here, we want to organize mentoring sessions of 3 days, and during these 3 days, the mentor and the mentee can go over what is not being mastered. And if there's a case study that is relevant, they can go together, they can work on it together. If the provider is still not competent after 6 months, it is retrained or sent to maybe another mentor because maybe there's not good communication or something is off. So a tutor may accompany a maximum of 3 mentees up until they have mastered the skills. And those tutoring sessions are individual and are tailored to the type of services. So here it's 2 people, and when they end, they reach out to another person if there are too many people. They can do the same day, maybe staggered, so they can start during in the morning while the other one will be doing at work in the afternoon. So it shows that the service doesn't stop and the training continues. During the sessions of the professional and social aspects will be addressed as needed to strengthen the bond of friendship between the mentor and the mentee and understand what is going on. Next slide, please.
So in which area have we been practicing this tutoring? Like I said, it was within the framework of the interventions that are led, maybe like I mentioned earlier, and it was focused on family planning, on long-acting methods in counseling, like I mentioned before, so implants and UI, and this is for postpartum cases for women. Regarding post-abortion care, that's also within the comprehensive abortion care. That's what we call it because it's in two sections, let's say. So we have post-abortion care and also safe termination of pregnancy. So what we mean by that is that it's both ways. So surgical or through medicines, where it's about surgical methods. Of course, it's more complex and technical, while for medicines, it's a little bit more, like on the patient side, it's a bit more straightforward. Regarding the practical organization of tutoring, like I said before, we are on the field with a score card that we can use for grading the experience. And this is the grading ratio that we've been using. So when the provider gets 100%, we can say that the provider has the master of the skill. He's mastering the skill. So, for example, when we are on the field, if the tutor is following the provider while the provider is actually doing the procedure, then according to the mastery of the skills that the provider will show, then this is where the tutor will give the rate. So if this rate is within 90 to 99%, then we can say that the provider is competent, but he needs or she needs support until mastery of the skill. When the score is below 90%, then we consider that the provider is not competent enough and requires close monitoring. So the mentees that are declared incompetent will have to transfer their skills to someone else. And according to their score, they could be used for other tasks. And then they have to talk together between the tutor and the mentor and the mentee, or the tutor and the tutees. The idea is really to have someone by your side for the provider to improve your skills. And it's really to learn the methods and techniques.
Alors, pour conduire ce tutorat aussi, bon, il y a quelques indicateurs également que nous avons.
Regarding the indicators that we've been using for reporting in terms of mentoring, there are several types of indicators that we have identified, and it allows trainers, providers to know what they have to improve. It's a big list of many things, but we believe that it's important. The number of trainers and tutors involved, the number of service providers involved, the number of service providers who received on-site training during the period for all kinds of services, the number of services, etc. You see that all the list here is not exhaustive. So I would like to now present the results. We have been implementing that program for 5 years, and we do have a few conclusions that I would like to share with you. In total, we have had 152 service providers that were mentored on 4 topics. So divided according to the first phase, and then to the 5th phase. As you can see, you have what is on the graph on the side. And some service providers were mentored in 3 sessions, others in 2 sessions, and others in 1 session. But this resulted in a total of 963 mentoring activities. And what I can say is that the graph shows the average performance of the participants. So, like I said, in some cases, some providers were mentored for 3 sessions. For some others, it was easier to score them in 2 sessions, and for some, in 1 session, it was enough to have a good assessment of the skills of the providers. And sometimes it was the provider themselves who required assistance not to make mistakes or to get better, to improve, and to be trained. So in total, like I said, we had 963 mentoring activities, and you can see the percentages within this month. For the first session, you can see that in pink, or maybe it's orange on your screen, I'm not sure. This is the part where the providers had a score below 90%. Then you can see in the green column, it's for those providers who were between 90 and 99%. And then yellow, let's say, on the right, this is 100% for those who mastered, who were considered to master the skills. So you can see on this graph that the first bar that is below 90% goes down, while the yellow goes up. And you can see that also the green one is kind of going up. And what we can say is that there is an improvement of each provider as the sessions go. So this picture here shows the 4 procedures that have been implemented. The first one is about améliorer. We can see that there were 3 sessions too. And it goes down on the second session, but then the third session is very promising. And also for the DOPP on the right, you can see that it really goes up from 89 until 97 at the third session. And also for DDI, the DDIU, the evolution of average scores goes up too. And even in the last one for implants, we can see that we were struggling a little bit on some aspects, but the important thing is that the average curve is going up. Next slide, please. So, dear participants, what I would like to say now is that this activity of tutoring was not as easy as it seemed at the beginning, because we had to have providers who could actually practice, who could show the practice. And it was not always easy for any session to have providers willing to practice in front of us or to have the opportunity to have providers practicing. So that's the first difficulty is the rarity, the scarcity of places for practicing outings. We also had safety constraints because of the context in the country. Some people come and work in the morning only, and then there's no one in the afternoon. So that was one other reason for which the rarity of cases was huge. And I'm talking about safety constraints because there were a lot of terrorist attacks in these last few years, which brought a lot of issues in areas where there were lots of challenges in terms of security. And so there was in some cases, there was no room to even talk about abortion. So that was very complicated in some cases. Which lessons did we draw from this experience? Well, some providers thought that it was very clever to actually organize mini campaigns. For August, for example, there will be a mini campaign for 3 days where there is this method, the long-lasting method, will be promoted. And so they do counseling, and then when people are interested, then the tutor will go and tutor someone. And they found it very interesting. There was also the commitment of the district health team that I would like to congratulate while I say that. that was crucial to the success of this approach. And thank you so much. Congratulations for this amazing work that you've been doing for 3 years. Thank you so much. So we also considered some aspects for the successful implementation of a mentoring program according to what we identified during our experience. So, for example, for those services that we, like post-abortion care, like I mentioned before, so we have to provide good training for tutors. We have to equip health facilities with medical equipment. And maybe if someone in the room here would like to implement this kind of practice, these are things that you might want to consider. So again, good training for tutors, because it's not just about gathering people and give them some aspects and just let them go. This training is capital. It's very important because there are lots of requirements, and it's important for a good practice to have a good training. So I'm saying that for those people who participated in this training, who stayed during the training, and because of this scorecard, we saw that there were a lot of competent persons, and it's not always easy to participate in such an endeavor, right? The other thing is to equip health facilities with medical equipment. That's very important, because if you train your staff and you don't equip them with medical equipment, then that's going to be a failure. I was talking earlier about what is important for experience on the field, and we have noticed that an anatomical model should be available. Also, you have to have a specific duration for tutoring and a system for recording skill scores, like we showed you. We just put this under family planning for this experience, but of course, we also have some in areas we have done other activities too. Another thing that was interesting for us, we thought, was to conduct mini campaigns, like I said, to mobilize the community. It's very important to communicate regularly and to talk about the quality of the work we're doing, about safety also, of the data that we generate. And that's why it's important to regularly update data collection tools and supervising the district management team, because it's not just an activity, it's really to reinforce the health system, the healthcare system. So it's very important to insist on this. So if we want quality and security, that's what I wanted to say. In terms of conclusion, dear participants, what can we say? Well, we can say that an insecure environment reduces the staff mobility. And like the moderator said at the beginning, when actors have to travel from one region to another, then it doesn't work. And even someone who's retired, who has actually to train, that doesn't work, because that brings a lot of insecurity. So we need qualified staff. We need qualified trainers who can tutor properly our providers. So that's why we thought the solution was therefore mentoring. We think it's really important in those remote areas that are very hard to access. And in our opinion, it's really important to give confidence to providers, not just training, but confidence also. And the success of this approach will depend on the motivation of the mentor and the experience of the mentor to provide appropriate support to learners, because you cannot transmit competences if you don't have them. That's what I wanted to share with you today, and I thank you so much for listening to me. Thanks. I think we can go directly to the délocalisation supervision now? Yeah, just maybe take a moment to breathe and relax. Thank you very much. Well, dear participants, indeed, we have just finished the tutoring presentation, the clinical tutoring presentation, and I hope you enjoyed it and that you learned a few things. Indeed, when we have competencies, then we can train better. And also, it's important to have motivation also for tutees and mentees. We have to have the right competencies on both sides. That's what I would like to say.
Ok, merci, Dr. Daguari, de me donner encore la parole pour parler d'une
Okay, thank you so much for giving me the floor again so we can go deeper into another aspect. So now we're going to talk about remote supervision or decentralized supervision in order to improve, again, the quality of healthcare provision in areas with significant security challenges. And here it's really in a happy mood. It's really not in a happy mood that we started this program, this initiative, because it's not just about healthcare, it's also about security environment. And we realized that there were lots of health formations that had to close because of the challenges in terms of security. The teams could not even access these formations. So it was really important to see how we could solve the problem, how we could support these providers and give them training that could be accessible for them so that they could actually work. And so that's why we're talking about decentralized supervision or remote supervision. I think I already talked about the context, but I'm happy to give more details if needed. As we said, since 2015, the country has been facing a security situation that has led to difficulties in the provision of care due to a lack of qualified personnel and the inaccessibility of certain FS for monitoring activity. So to address these challenges, that project has adopted resilient strategies, including decentralized supervision. Next slide, please. The aim here is to show you the process that we followed and during these 3 years. Because like I said, the decentralized supervision was really aimed in having a remote supervision for those cases where we could not access the areas. And so what do we need to do? Well, we needed to find a way to guide and monitor and support the staff that were in villages where there was a lot of insecurity, because people would know them, and then we could tell them where to go through and which path or which road to take. It was very practical. Which definition we could give? Well, formative supervision could be defined as a process of guiding and monitoring and supporting staff to promote compliance with standards of practice, ensure the delivery of quality health services, and support the professional development of individuals. So you can imagine that for people who are in a village that are isolated from this district and no one is calling them, and what do they do? No one is checking on them from the ministry, or it's almost impossible for those people to actually access to those services, right? So that's why Pathfinder decided to launch this initiative for delocalized supervision or decentralized supervision, so that we could invite some providers located in areas with significant security challenges in order to assess the quality of services. Next slide, please.
So practically speaking, how does it work? Before supervision, you have to take into account certain aspects which take place in all supervision. So preparation in terms of reference, budget, photocopies, information.
Alors, pour l'élément capital dont il faut
So
tenir compte
the key element that we need to take into account here is to tell these players to take photos and videos of what they do in their maternity wards, and they can assign somebody to do it, or maybe the head of the maternity ward can do it, because those are key information for the rest of the training. So during the supervision, what is happening? So we identify everything at the district level, and you don't want to pick players that do not understand anything that's happening in maternity wards. You have to assign people who are the key players, notably the person in charge of SRHR, or anybody supervising in the district. So there will be an interview between these two players, and then we will go over all the documents, which is called a record of family planning, regardless of the service, to appreciate the quality of services that were provided and assess the quality of data that were shared. We go over those videos and photos because you can question the bias. And so when you say that somebody that they're going to be supervised, you know that they're going to try to improve the quality of their services. But we know that something's going to be skipped, something's going to be missed. So it's a good way to really have a good idea of what's going on. So you want a grid to check all the different points of what's being supervised. And then there's going to be an interview to go over the photos, the videos, to provide feedback on the different aspects of the service, congratulate them on what they did good, and course correct on what didn't go so well, so that they can leave with recommendations that they can provide other people and apply them in their practice. After the supervision phase, we move to recommendations. They're going to apply and share what they have, the information received. They are going to implement the recommendations. And of course, those who led this supervision, we will draft a report that will be provided to the head of the ward or whoever is needed. Dear participants, dear moderator, so we have collected some results because during the 2 years of this approach, we were able to supervise 57 1 year and 85 the next year. Year 5, we couldn't do any because the security situation was better, but we remain in touch with those healthcare facilities for a minimum of activities. So, of course, the ideal situation is when you can be in person with the person, but for delocalized supervision, we did it for 142 healthcare facilities. They are spread out in different regions, and the regions that the region of Bangui was the one that benefited the most, with 62 healthcare facilities, especially in the Nuna district. So for the region of the North, North Center, and North, we were able to supervise 35 of them, and for North, for Yatka, 52 of them. Ladies and gentlemen, for what follows, thanks to the grid of supervision, we were able to score and rank them according to their performance and according to the type of activities they were performing. And according to this grid, we noticed that most, if not all, were above the average, which is 75%, for each of the areas that was supervised. So there's some gaps in the organization of services. Because clearly there was not a good organization of services or of meeting of services. It was not done on a regular basis. So also for the display of different tasks, that wasn't done correctly. The second element which received low score was prevention of infections. The score was not great. And also the gathering of tool of data collecting. If you do not provide an exact description of your task, you might be accused of not doing your work correctly, but in the end, it doesn't reflect reality. Next slide. So of course we experienced challenges. We experienced pretty good results that could be duplicated in other healthcare facilities. But we had to face some challenges. Even though those healthcare facility agents could move around different facilities because they were known in those areas. And sometimes they knew where to go and not to go to not, to experience, to step on landmines or what do we know? So they knew where to go. The security measures imposed by local authorities also prohibited the movement of certain type of vehicles. So it was really hard for our workers to go to specific districts and to do their work. And the scarcity or even the absence of public transportation has considerably reduced travel. That being said, we drew some lessons, especially the resilience of our providers. Imagine these people, what they went through, understanding that, they can be ambushed by terrorists, they'll step on landmines, but they are dedicated and they wanted to go to those healthcare facilities to do their work or even stay in touch with the people in charge. The other challenges, the other lessons learned were that some of the images and videos that are not usable because the quality was low, If the photo is of bad quality, its appreciation, it's hard. And if the video is subpar, of course, you cannot really use it. So that played on some of the decisions that were made.
Alors, ici aussi, on s'est dit, on ne le souhaite pas, il peut arriver que dans certaines zones également, l'accès soit difficile. Et qu'on veut mettre en place donc
we want to put into place these delocalized. So the image talked about tutoring, but
ces acteurs-là. Il faut disposer également de téléphones Android. Bon,
so we have to use Android phones.
C'est le projet qui va le payer pour déjà, mais bon,
who's going to pay for those? But we know that we want those agents, those workers, to have Android phones, which enable them to take good photos or good videos. You have to provide and update data, collect data on a regular basis. Comply with safety measures in each location. And also plan activities well during quiet periods, because when the situation is really challenging, tell them to work. So make sure that the situation is calm and peaceful so that they can come and so that we can appreciate the work that they do. Dear participants, so to enable the success of this delocalized supervision, we need resilient workers. Truly,
très résilient et qui
extremely resilient, that are willing to accompany their population for their well-being and support them through quality services, strengthening those services and adapt to challenging safety, security situation. Ladies and gentlemen, Mr. Moderator, we have reached the end of this presentation, and we hope that we had a favorable and positive impact to those who listened to us. And we hope that those two approaches could help you in situation of challenging access, could be made available, and we are available to help you accompany anybody who's willing to implement these practices. Thank you very much. Thank you very much. So if I may, this is a tutoring image where the mentee, so the mentor is on one side, who's observing the mentee. Thank you so much. Thank you so much, Bini Bunini. Thank you to all of us who listened to these presentations. So before we move on to Q&A, we have testimonies. So for clinical tutoring, there's a mentor and two mentees. Same thing for the delocalized supervision. So one supervisor and two supervised. So let's start with the clinical tutoring. Mr. Boubacar Nabalou. Are you here?
Oui, je suis là, ici, présent.
I am here. What did tutoring bring to your personal and professional practice? Before you answer, please, those who do not speak, please cut off your mic. Thank you so much.
Yeah. Je suis Rabouloum Boubacar,
My name is Rabouloum Boubacar.
Alors, je vous remercie pour cette opportunité.
Thank you for this opportunity.
Je dirais que le tutorat m'a apporté beaucoup de choses.
Tutorat brought me a lot on a personal level.
D'avoir encore plus confiance en moi-même.
It allowed me to build my own confidence.
ma modeste personne, à l'endroit de ma modeste personne, en me choisissant comme tuteur, ça m'a permis
So
vraiment de
being
gagner
chosen
la
as
confiance
tutor,
de
as
sur
mentor,
ma formation sanitaire.
because
Ça a
I was
permis
being shown some trust.
sentir la confiance de la tutorée
And I
et de sa
felt the
collaboratrice,
trust of the mentee
dans le cadre de tutorat en d'autres formations sanitaires. Et en somme, sur le plan personnel, c'est
So
vraiment une
all in
satisfaction
all,
totale pour ce qui est
it's
de
a total
social. Sur le plan
satisfaction on a personal
professionnel,
level.
ça m'a permis
Professionally
de
speaking,
voir la réalité des formations
I was
tutorales
able
professionnelles,
to
de
really deal
voir
with reality, a reality other than mind,
que rencontrent
understand
certaines personnes. Ça me
challenges,
permet aussi la résilience
understanding the
professionnelle. Ça m'a permis
challenges
de
of
renforcer mes
certain
compétences et mes
healthcare
connaissances.
facilities, but
Ça
also
redonne
reinform,
aussi
strengthen my own
ça m'a permis
competencies,
également de donner et de recevoir
my
beaucoup
own
d'expériences
skills,
avec
but
la
also
tutorée, de
receive,
découvrir autres paysages,
collect
pour
data,
moi une sorte de formation
and
continue.
it was like
Ce
almost like a
tutorat,
continuing
pendant ce
education.
tutorat, j'ai eu une sorte
During
de
this
sensibilisation à
mentoring,
réaliser avec la tutorée,
there was
ce qui
some
était
awareness.
riche en enseignement. La joie se lisait
The
sur le visage
joy
des clientes
to
après chaque
see
prestation,
on the
lorsque les soins
face
sont
of each
finalisés, et
client
c'était motivant.
after
Donc, à l'occasion de ce tutorat,
each session.
nous
So
avons
that was very
renforcé un
motivating.
lien qui existait et
So
après aussi
we
d'autres liens professionnels avec
strengthen
les
our
collègues,
links,
ce qui persiste
personal
aujourd'hui
but
jusqu'à aujourd'hui.
professional
Je
with
me
other
rappelle, la
colleagues.
semaine passée déjà, j'ai été invité
And
là
I
où
was
j'ai
invited,
tutoré
for
pour aider
example,
à gérer
where
le
I
cas
was
de suivi de cas.
mentoring
Voilà. Et j'ai
for
eu
a
tout le
case
déplacement de
study,
gérer ce cas. Et dans l'ensemble, tout s'est bien passé.
and everything
Donc,
went really well.
pendant ce tutorat également, nous avons eu à découvrir de bonnes pratiques de
We
la
also
santé
discovered better
entre le
practice,
ministère de la Santé et puis l'enseignement.
practice
On a vu
between
des collègues
the
qui
Ministry of
on
Health and
apprenait
the
2 ou 3
ASIMA,
trimestres par classe
getting to
à la
know
responsable
different
maternité pour
colleagues
sensibiliser les élèves sur la santé sexuelle et
to
reproductive,
bring
ce qui m'a
awareness
motivé à entreprendre des démarches pour que cela soit aussi
to
possible au niveau de
students.
mon CSPS. Dans
Um,
l'ensemble, nous disons que ici,
so
à la sous-préfecture de
overall,
Boromo, il n'y a pratiquement plus de référence au CMA pour les cas de soins après avortement et
the,
d'insertion du avec l'intervention du PCLV. Les CSPS sont aussi bien équipés en matériel
these
que
aspects
médicaments nécessaires
allowed
pour
us to
assurer
really bring awareness of
pour
maybe some
assurer ces cas.
shortages of
Donc, l'occasion pour
medication,
moi de
of
remercier
supplies.
ministère de
So
la
I want
Santé,
to
le staff
thank
technique
the
du
Ministry
Passandor,
of
le budget
Health,
PSLV, l'équipe santé du
Pathfinder, and the project,
coordonnateur district de PSLV en
and
l'occurrence,
the
M.
district
Mao, le
coordinator,
responsable de formation sanitaire et l'ensemble de mes collègues
and
qui ont
the
assuré la
head
poursuite
of
du
the health
merci encore,
district
merci à vous.
who allowed me to do this mentoring session. Thank you so much.
Merci, Monsieur Rabolum.
Thank you so much, Mr.
Madame
Rabolum.
Saodougou Aïcha est là.
Madame Saodougou Aïchaïra,
Oui, je suis là.
Nous allons vous
I'm
demander
here.
de donner votre appréciation
Now, if you can
de la
provide
pratique du
your
tutorat.
practice,
D'accord.
your
Bonsoir
experience
merci
of
à vous pour la
tutoring. Good
parole.
evening, all of you, and
Je
thank you for
réponds au
giving
nom
me the
de Madame
floor.
Saodougou Compaoré Aïcha, sage-femme à la maternité du CM Capalin dans le district sanitaire de
So
Niger.
I will talk
Mon
about me
appréciation
as
concernant le
a
tutorat
midwife. My
est
appreciation
satisfaite,
as
elle est positive,
mentoring was a very
parce que
positive
le
and great
tutorat
one
m'a permis de
because
renforcer les liens avec
mentoring
mes collègues.
strengthened my
Ça m'a permis de
bonds, my
renforcer les liens
relationship with
avec
my
mes
colleagues,
clients.
but also with
Et
the
ça m'a permis
clients,
également de
and
renforcer mes compétences.
to
Voilà, et
strengthen
d'améliorer
my
mes compétences
skills,
également.
to make them better.
Voilà. Avant le tutorat, on avait
Before that,
certaines manières de pratiquer qui n'étaient pas du
we
tout adaptées.
had
Et après
practices
le
that were not
tutorat,
really
franchement,
adapted
tout a
anymore.
été
And
amélioré.
after
En matière de prise
tutoring,
en charge
everything
des
was
après
made
avortement,
better,
en
especially
matière
post
d'insertion d'implants,
abortion
DIU,
or
PPI,
the
etc.
insertion of
Vraiment, nous avons
implants.
amélioré nos techniques.
This
Et
enabled
nous
to
continuons
strengthen and make our
tutorer entre
technique
nous-mêmes.
better.
Moi, en tant que
And we
tutorée,
continue tutoring
et entre collègues,
ourselves.
on
As
fait notre
mentee,
tutorat en
we
interne.
we
Voilà,
do
parce que
this
les collègues
internally to
trouvaient que
each
c'était
other
intéressant.
because our colleagues really thought that the
Il y a d'autres
approach
collègues
was a
qui n'ont
great
n'ont
one.
pas eu la chance
Other
d'être
colleagues
tutorés,
did
qui n'ont
not
pas eu la chance
experience this
d'avoir
tutoring
formation
or having this
Donc,
tutor mentee
en
relationship
nous voyant
via
pratiquer
Pathfinder.
et vu
So
les
they saw the practice, they observed that our skills were getting better, so they decided to do it themselves. So this is what we do. We've decided to do internally between colleagues. And I want to thank Pathfinder through the project Sauver la Vie, and thank our mentors, and Madame Ratam Razali, who is in charge of the Northern region, and thank you to my colleagues.
Merci, Madame.
Thank you so much. Thank you so much for what you said. Now, we are going to give the floor to Rosine.
Bonsoir.
Yeah, hi. How are you? Yeah, I'm here.
Oui, je vais bien.
I'm fine, thank you. So what would you say about tutoring? Well, so my name is Rosine. I am in the Soleil Health District, and I would like to thank you for giving me the floor. Tutoring was really appreciated. It was a great experience because it allowed me to improve collaboration within the services, and the sharing within among colleagues really helped warming up the atmosphere, and it brought us closer. Conviviality also in the team. It built really a state of mind that was really on the teamwork. Regarding postpartum services as well, and also for all the infants, and that's what I'm taking care of. So it really helped me. I'm also taking care of post-abortion care. And when I practice this, because I do the procedure too. And this was this is in the service, and outside of the service, we also gather for social events, like for birth, celebrations, baptisms, or funerals, all kinds of celebrations. So I thank Pathfinder, and these are some assessments that I got from the tutoring. Thank you. Thank you so much.
Merci à Rosine.
Thank you, Rosine.
Alors, nous allons passer au témoignage sur
now we're going to talk about
la supervision délocalisée.
Decentralized supervision.
Nous allons commencer par
and we're going to start with Stanislas.
Oui, docteur.
Yeah,
oui, je suis
hi.
là.
I'm here. Great. Can you please talk about the approach that you had in your district? Yes, of course. Sure. Thank you very much for giving me the floor. And hello again to everyone. So my name is Stanislas. I am a supervisor, and I am in charge of the health district for reproductive health. For me tonight, it's a great honor to share the experience of the district about the decentralized supervision approach. We must say that the safety situation in our district is very difficult because of terrorist activities. And thankfully, organizations like Pathfinders are really helpful, and they allow us to work on family planning issues and also violence-based, gender-based violence. The interpreter is sorry, but the sound is very bad. We are trying to give access to the population on reproductive health services. And in our district, the situation is very complicated. Within the last few years, there was a possible, the interpreter is sorry, but it's very hard to understand the speaker. There were possibilities from providers in the headquarters and Pathfinder, in collaboration with our team, continue to support us in our activities. So for supervision, formative supervision, that is a very innovating approach, and I would like to stress that this approach was in two phases. After the first contact, now the first step is really to have a recording of what providers do according to the indicators when they are being monitored, and also to bring some tools within the district. The internet connection is very bad. The interpreter is very sorry. And now, even with supervision of experts who actually can look at the recording, the video recording, to give advice and assessment so that we can understand better some aspects and give recommendations. The supervision is also, it also includes the setting up of events within the health formation, and this is very innovative in the way that they also provide feedback to make sure that the providers practice in safety, in a safety environment. Regarding the activities, also that they can provide services safely in their community. I would like to thank everyone in the Ministry of Health, everyone in the NGOs who help us, and especially here to Pathfinders who have been supporting us for so many years. But I will not forget my team within the district who really was very helpful. And thank you so much. Thank you to everyone for everything you did. I give the floor back. Thank you so much. Thank you so much, Stanislav. Abdul, would you like to say something? Abdul Sankara, are you here? Yes, I'm here. Wonderful. Thank you for being here. What assessment can you give of the decentralized supervision strategy since you were a beneficiary? What would you say? Well, thank you very much for giving me the floor. My name is Abdul Sankara, and I work in the Kaya Health District. Regarding the decentralized supervision strategy, well, I must say that it allowed us to stay in touch with the district, despite the conditions that are pretty difficult because of the safety issues that we mentioned before. And sometimes it's very interesting to have the ability to see videos of practices. And what I liked about the centralized supervision strategy is that recommendations are made in order to improve the well-being of the population. We realize, thanks to that strategy, we realize that we have the power is in our hands. And we thank Pathfinder for this initiative. It was very efficient. And thank you so much for your support. I thank you very much.
Merci.
Thank you. Thank you so much, Abdul. Safiatou, would you like to say something? Yes.
Merci.
Thank you. I'm glad you're here. What improvements have you observed in your CSPS after the decentralized supervision sessions? Well, first of all, let me thank you for giving me the floor and for your consideration. Hello, everyone. My name is Safiatou Koulibaly. I am working in the South District of Nuna, and I'm 20 kilometers away from Guinea. Regarding this approach, this decentralized approach, well, for improving the reproductive health, I think this decentralized initiative was really welcome because it really helped us overcome the fear that is everywhere around us because of these safety challenges that we're facing. We have so many, this is really hard. I mean, daily life is really hard. And having the support of this initiative is really, it changed really everything. Because of this supervision, we could put into practice all these recommendations that have been made. And during these sessions, we really learned a lot of things, and we could reinforce the availability of all the inputs. And we could also promote the adoption of a method that is very useful and efficient. Also, we could have more tools, electronic and physical tools for reports and, for example, and now we can provide quality services to the population. That is very important. Thanks to that decentralized supervision, we can now offer quality services to the population that now is now satisfied. I also wanted to thank all the team for this project, and in particular, our district assistant. He's always here. He's always here to help us whenever we need him, and I thank him very much.
Merci beaucoup,
thank you so much. Thank you, Safiatou. Ladies and gentlemen, we have listened very carefully to these two presentations, and we have listened to the testimonials as well, and about the results. We are now going to open the Q&A session so that everyone can talk about share some comments or.
Oui, Dr. Dajori,
are you here? Yeah. Maybe we can give a list of all the questions that have been raised, and yeah, allow me. Sure, go ahead. Indeed, there are questions already that have been put in the chat, so maybe I can read them briefly. The first question that was raised was there something implemented to have more efficient interventions? There was another question about what's the difference between formative supervision and coaching. Also, I see another question, a third question about is it only the district of Nuna who benefited from this activity? And how was post-supervision follow-up organized.
Donc, ça, c'est les deux questions de Woro.
So these are the two questions of Woro.
Et une dernière question
And the last one
de Monsieur
from
Arunazaku,
Arunazaku,
qui demande à savoir dans
who
quelle
asks
mesure ces
about
deux approches-là ont contribué à
how
augmenter
these two
l'utilisation des
approaches
services.
contributed to
Donc,
increase
voici
the
un peu
use
l'économie
of
des
services.
différentes questions
So I will maybe
qui ont été
try to
contenues dans
keep
le
these
chat
questions in
par
mind
Monsieur le modérateur.
of what has been raised here. Thank you.
OK. Merci
Okay,
beaucoup.
thank you very much.
Je vais juste donner quelques éléments de réponse.
I just want to give a few
Les
answers,
intervenants peuvent compléter.
and then the speakers, of course, can
Notamment le
add their
genre.
own
Il faut dire qu'au niveau
contributions.
du Burkina, dans toutes nos interventions, le genre
And
est
we can say that
intégré.
in Burkina, for
Et comme vous le
gender-based
savez, il
issues,
y a eu un décalage
as you know,
il y a
there
un
has
décalage dans
been
certaines
a
professions.
little delay for
Quand vous
some
prenez la profession
professions,
sage-femme, c'est essentiellement des femmes, c'est
occupations
vrai, mais
that,
nous avons aussi des
especially
hommes
for
au
women
total
indeed,
qui
but
sont
also
dans le
for men.
mais c'est beaucoup plus de femmes.
It's a lot of
Quand on prend les médecins, il y a plus
things that
de
happened,
femmes.
and
Et de plus en plus, on a
among
des femmes
others, for
médecins
doctors,
qui
we have a
émergent.
lot of
Et
men,
sur le
of
terrain,
course, but there are
le
more and more
genre
women
est
who are becoming doctors,
intégré. Donc, on ne
and
fait
they
pas
are more and more
de,
integrated.
il n'y a pas de favoritisme en fonction
There's
de
no one
l'âge,
favored.
sexe et autres.
We're trying to anyway.
Bon, coaching, supervision
So about
formative, je pense que
coaching, the
ça
difference
dépend
between
des
coaching and
pays,
formative supervision,
parce que
well, it
chaque
depends on
pays
the country
élabore
actually,
ses politiques
because
et
each
normes
country has
et
its
donc
own
donne un
policy
contenu
on
aux différentes
requirements and standards,
expressions qui
and
sont
I guess they
utilisées.
all have
Donc, au niveau du
different
Burkina, la formation, la
criteria,
supervision
but
du
for
moins
Burkina Faso,
s'adresse prioritairement à des prestataires.
it's mostly for
Alors
providers.
que le coaching, selon
Formative
nos
supervision is
politiques,
for
notre
providers,
protocole,
while coaching
c'est un
is
accompagnement qui concerne
really
des personnes,
a way
pas
to
forcément une seule
support
personne,
people,
ou
not just
des équipes,
one, or
à
teams,
faire émerger leur potentiel
in order
et
to
augmenter leurs
explore the
compétences. Donc,
potential.
voici la
And
définition qui a été retenue au niveau du
this
coaching.
is the definition that
Nous avons aussi
was
le
identified anyway. We
compagnonnage,
also
pardon,
have
où on
what we call
envisage
compagnonnage in
lorsqu'une femme
French,
vient en
companionship in
consultation
English.
ou lorsqu'elle vient surtout pour les
That
accouchements,
is
pour
like
un
when
accouchement,
a midwife comes for a
nous demandons à
delivery,
ce qu'elle ait
then we
un
ask
accompagnant de choix. Voilà. Donc, elle
what
choisit sa
who
femme ou
would
la
be
plupart qui sera avec elle
the point of
dans,
contact, the preferred
dans la
point of
salle
contact
d'accouchement.
in the
Et donc,
delivery
pour que
room,
cette femme puisse jouer son rôle,
and so that this woman can
on
actually
l'encadre, qu'on l'oriente
be efficient in
jusqu'avant
her
qu'elle
role.
rentre dans la salle d'accouchement. Donc,
Then
c'est des cadres qui sont définis selon chaque
we
pays.
can ask some companion
Et bon, en fonction des
to
pays, la
support
définition
her
peut varier.
before she arrives in the
Donc, voici
delivery
ce que
room.
j'avais à
So
dire.
that's what I wanted to
Peut-être
share.
Bonini
But now maybe Bonini can
et tous ceux qui ont témoigné,
follow up.
compléter.
I give you the floor.
Merci.
Merci,
Thank you so much.
Dayouari, déjà pour
Thank you so
éléments de
much, Doctor,
réponse
for these answers already.
en tout cas
That
très
is very
justes.
helpful and
Peut-être ce que
very
j'allais ajouter à ce que Dr.
completely
Dayouari a dit par
fair.
rapport à la question sur l'analyse, genre déjà
What I
même avec
wanted
le
to
projet
talk
PSC
about was maybe the
il y a
question about
eu ce qu'on
the
appelle
project.
l'analyse genre même
What
pour
we
le
did
projet. Et
was
toute
that
activité qu'on
there
met
was
en œuvre donc respecte en tout cas
an
le genre,
activity,
que ce soit
that we
par
really
activité de
stressed that
protection,
we
activité
respect deeply
en tout cas pour tout ce qui se fait sur le terrain,
all
que le
genders.
genre est pris en compte.
And I want to
S'il
say
faut
that all
noter que
activities
même
that are
Pathfinder, même de façon
on
globale,
gender-based
ne fait même
issues
pas une activité
are
sur
taken very
le genre.
seriously. This is something very important for us.
La question de Oro sur Nuna Seul, je dirais non. Dans la boucle du Mouhoun, il y a 3 districts qui ont été
So there are
concernés. Je ne peux
3
même pas voir
districts that
le
were
district de
involved:
Ditougou, le district de
Ditougou,
Solenzo, Nouna,
Solenzo,
Touma
Nouna,
et
Touma,
peut-être Tougan qui étaient concernés.
and
Donc, il faut
Tougan
dire, sauf
were
Boromo, peut-être
involved,
qui n'était pas
except for
concerné.
Boroma, which was not involved.
Sinon, la plupart de ces districts
Otherwise,
ont été confrontés à des situations
most
bénéficiaient
districts
de ces supervisions délocalisées.
were confronted to
Maintenant,
this
comment se
situation,
fait?
benefited from those services.
En tout
So
cas,
how do you do follow-up?
c'est vrai que c'est l'accompagnement de Pathfinder et tout.
It's the
Mais
help
le
and support of
diagnostic
Pathfinder
vraiment,
was
et
key.
nous, on ne fait juste que de l'assistance technique. On ne se
But
met pas devant
we
pour
we're not in the front here. We are helping on a technical basis. So there's a great follow-up work that's being done and to see how those actions were implemented in the course of these supervisions. Last question comes from Zakou in Niger. Thank you for your participation before anything else, which shows that you really you appreciate what we do in the field.
C'est peut-être parce que c'est juste le processus qu'on a montré ici. On est
This is the process that we showed. We did not go into details to show each approach. But when it comes to family planning and post-abortion care, many players were enabled, which helped us to not refer any patients outside. There was a testimony that showed that before, when there's an abortion case in a healthcare facility, it is immediately taken care of, which reduces the mortality of these cases. And so that they can really take care of true emergencies. When we look at our OKRs, when it comes to treatment, we can't say that we offer different methods of family planning. So anybody who comes to see us, there will always be somebody who welcome them and offer some care. So this is quality that we can appreciate. From a quantity perspective, of course, numbers speak for themselves. We could share some of our reports. We go over the country average in the healthcare facilities where we work. So sharing this information, or scaling up this information and these practices is key. So when it comes to delocalized supervision, it strengthens the link and the bond between the different players. It allows them to increase and improve their skills and their competences. So it is really important. So very often there's some loss of data when they're not added correctly. So you want to fill out this dashboard to track, to create indicators so that we understand what is going on, what's lacking, etc. I hope I answered those questions. I don't know if anybody else here, maybe if anybody wants to add anything additional. Thank you, Mr. Moderator. Thank you so much, Denis Bonini. Does anybody have anything else to add?
D'accord.
Okay.
On peut poursuivre les échanges.
Now we may continue.
Qui n'ont pas écrit dans le chat et qui veulent parler directement.
Those who didn't write anything in the chat that want to take the floor, I invite you to do so.
Ok, je vois il y a M. Swali qui a la main levée.
So I think Mr. Swali has his hand raised.
Monsieur Soale, qui a la main
Mr.
levée.
Swali, who raised his hand, would you like to take the floor?
Ok, on peut lui donner directement la parole en attendant que les
Please
autres
go
réfléchissent.
ahead
D'accord.
and give the others time to think.
Donc, Monsieur Soale, vous avez la parole.
Mr. Swali, you have the floor.
Si vous parlez, on ne vous entend pas. Hein.
Okay, if you're
Attendez.
talking, we cannot hear you.
Allez-y, voir. Normalement, ça doit passer maintenant. Oui, maintenant c'est bon. 5 sur 5.
En fait, une partie de l'équipe de partenaires du webinaire dans l'histoire de l'État, dans les régions locales.
I'm really sorry, but the interpreter cannot hear. The sound is really bad, and the interpreter can't hear what's being said.
Bonjour, c'est Madame Konkomo Boulissa de l'Association burkinabé des sages-femmes. Merci bien
So
à Dr. Boulissa pour
I come from an association of midwives.
le document.
Here's my question.
Il faut signer un document entre le tuteur, le tutoré et
Do you have to sign a document between the mentor and the mentee?
ce document, c'est un document légal.
Is it a legally binding document? And what is the goal of this document? How does it work? Thank you so much.
Oui, on a bien entendu.
Yes, we heard you correctly. It was the document that was being signed. So can you please explain what this is about?
Okay,
Mr.
merci.
Dr. Denis Bonini?
Boulkissa pour sa question. En tout cas,
Thank you for your
très
question.
pertinente. Merci en tout
Very
cas
relevant one.
aux sages-femmes d'être
Thank you
connectées et écouter donc
to the midwives who are listening to this webinar, because you are one of the main players,
après avortement dans les merci déjà à vous.
especially post-abortion. Thank you for your
L'entente
participation.
tutorale, comme on l'a dit, c'est pas
So
un
this
document légal
document
qui va empêcher qui
is
de faire
not a
quoi que ce soit,
legally
mais c'est
binding
déjà de
document that
fixer des
prevents
bases sur lesquelles on va
anybody to do
travailler.
anything, but
Parce
it's
qu'à
to set up
l'intérieur,
some
on va
bases
mettre le
from
nombre de
which we're
séances
going
qu'on
to
va faire
work,
et pendant combien de
because
temps
it's
la
some sort of
personne va
contract.
faire.
You're going to
Et
say
donc
how many
ainsi, c'est un
sessions there will
document de
be. So
travail
it's a
et
commitment.
peut-être
It's a work
d'appréciation sur ce que nous
document
allons faire.
and
Sinon,
a
ça nous
document of
empêche pas, parce que pendant
appreciation
ce
of what we're
ça
going
nous
to do.
empêche pas de faire
It
le
does
tutorat.
not prevent
Et ce n'est pas un
us
document auquel on va
from
dire que si tu n'as
working,
pas fait, tu ne seras pas payé ou bien
and it's not a
ne vas
document that
pas
says, well, if you
quoi
don't
que
do
ce
it, you're
soit.
not going to
C'est
get
vraiment
paid or
un
not do
document de
anything.
base pour faire le travail.
It's a baseline
C'est ce que je
document
peux
to
dire
get the
par
work
rapport à
started.
ça. Mais je pense aussi que le modérateur, docteur Dayouare, ils ont une bonne expérience
Doc-
aussi dans ça, parce que je pense que même dans le mentorat classique également, il y a
I
une
think
entente manuelle qui est
in
signée
regular
entre les
traditional
différents acteurs
mentoring,
d'accompagnement.
there's always some sort of agreement.
S'il y a peut-être quelque chose à ajouter par rapport à ça.
So if anybody has anything to add, please go ahead.
Ok, merci. Je pense que
Thank you so much.
Dr. Bounini a tout dit. Puisque
I
c'est juste
think
un
Dr.
document
Bonini said everything
qui
already. It's
donne
just
les
a
grandes
baseline
lignes sur lesquelles,
document
à
that
partir
gives
desquelles on va travailler. Parce que
the
s'il n'y a pas de document,
some
on ne peut pas
guidelines
travailler
from
sans base. Donc,
through which
c'est
we're
ce
going to
document.
work.
Vous allez faire telle chose, même les débuts
You're going to do this, this, and that.
de mentorat ou de
These are going to
tutorat,
be your tasks,
les heures de fin,
the
etc.
hours.
Tout est dans
Everything will
l'entente
be in that
tutorale.
document.
Et les thématiques sur lesquelles vont porter le tutorat, par exemple, si
And
c'est
of course, the
PF,
topics,
HPF,
whether it's
ça va
related
être
to
comme
family
après
planning
l'autosuffisance en amont, ça va être amont, ainsi de suite. Et c'est une forme de
or
motivation.
another topic.
Chacun
So it's a way
s'engage
to motivate
à respecter
people.
cet
So we all
engagement
commit
du tutorat.
to basically meet this commitment and this
Est-ce qu'il y a une autre
engagement.
voix?
Is
Oui,
there any other
il y a,
raised hand?
Nana Achatou qui demande
Nana
à prendre la
Chatou,
parole également.
who would like to take the floor?
Ok, elle a la parole.
Nana Chatou, you have the floor.
Peut-être que son micro n'est pas ouvert.
Maybe her mic is not working.
Son micro n'est pas ouvert. Ce micro. Je ne sais pas si vous nous attendez.
I don't know if you can hear us. Madame Nana?
Il faut peut-être activer le... Bon, en tout cas, la main est levée. Peut-être qu'il faut qu'elle active le...
So maybe she needs to activate her mic. I don't know if you can hear us. Maybe that was not intentional, but there might be some connection issues in Niger. So apparently they have some internet issues in Niger. But even if it doesn't go through, you can ask your question in the chat, and we will send it to the panelists.
Est-ce qu'il y a d'autres intervenants?
Other questions?
RAS. Pas d'autres intervenants.
No.
Depuis Kigali, il y avait des gens qui...
I think in Kigali, there were other questions. Are they still connected?
Il y a un deuxième main qui est là.
There's another hand that's being raised.
L'équipe qui soit allée.
Ok, on peut peut-être leur donner la parole s'ils sont connectés.
Go ahead.
La parole à nous.
Oui, allez-y s'il vous plaît.
Go ahead, please.
On vous reçoit difficilement.
So we cannot hear
On
you.
entend un écho, mais on n'entend pas de voix.
There's an echo, but we can't really hear you.
On n'entend pas.
We cannot hear you. I'm sorry.
Ok, merci.
Allô? Vous nous entendez maintenant?
Oui, parfaitement.
Lors de votre intervention, vous avez parlé du taux d'échec par rapport
So you talk about the rate of failure
Est-ce que le fait, par exemple, de déplacer
is
un tutoré
the fact that you're moving one mentee,
qui n'a pas les mêmes conditions que là,
that it's you a different work condition, will that have an impact on the results of the mentee?
Ok, je pense qu'il parle plutôt de la supervision délocalisée.
I think he's talking about supervised, delocalized supervision, right? I'm sorry, the interpreter has a hard time hearing, so maybe he's working about the different work conditions.
Ok, merci à Parfait pour cette question.
Thank you so much for your question.
Modérateur me donne la parole, mais bon.
I didn't wait for the moderator to give me the floor, but it's okay.
Ok, d'accord. Non, comme on l'a dit, hein, dans les résultats qu'on a présentés,
So as we said it earlier,
les cas d'échecs sont très, très, très rares. Mais bon, on ne parle pas d'échecs. Au fait, c'est des gens
there's no real failure here. Sometimes it's people that don't have a good relationship with their mentor. There's always, there's always some conflict, or maybe they just don't agree on some specific practices. And it might be the case here. So, for example, if after months of practices, the mentee cannot put an implant, we can either work with the supervisor of the district to support the mentee, or we can send them to a different healthcare district to work somewhere else. So you can always find somebody to help. So through another mentor, another mentee. But I don't think we would call this a failure. But everything that we have done so far, there were no cases of mentee working, for 6 months and not being able to practice. Thank you so much.
Merci.
Thank you so much.
Celui qui a posé la question est satisfait?
Did we answer your question?
Ok, merci. On continue avec les échanges. S'il y a toujours
Are there more
questions?
Pas de questions additionnelles. Je pense qu'il y a
No
une
more
petite question
questions.
qui vient d'arriver.
Maybe one that was
Il
posted in
demande
the
qui
chat.
peut être tuteur et quels peuvent être les outils de travail du tuteur.
So
Donc,
what are the
c'est une
tools
question de-
of the mentor? Who can be a mentor, and what are the
Je
tools
répète la question.
available to a
Qui peut être
mentor?
tuteur et quels peuvent être ses outils de travail.
What are his mentoring tools,
Ok,
basically?
je pense que
His or
comme on
her.
l'avait déjà dit, mais c'est bon de reprendre parce que comme c'était au début, surtout si la personne n'a pas suivi le début, c'est pas évident.
So we will go over the answers because we already mentioned this information. So during the implementation of this approach, we describe some criteria. To be a mentor, you have to be working within the healthcare facility where the mentee also works. You have to be a physician, a midwife, or a registered nurse or somebody working in the midwife ward, but you have to be working in that maternity ward. So given our topic, you have to be specialized in family planning. Otherwise, you don't have the right experience to support somebody. So you have to be working in that practice. What we want to add is to add specific aspects to it. So not only you have to be all of the above, but you have to have done a few steps from a technical standpoint, but also theoretical knowledges and andragogy. That's very important. How do you transmit knowledge to somebody else? How do you behave as a mentor? So those are aspects that we really need to take into account to be a mentor. Otherwise, it's any other person that works in the maternity ward and that needs to have further knowledge about a specific practice. We were talking about the tools.
These tools about the tutoring, these are the same that are used for example, the implants that we use. We also have Mama U and Zoe. These are tools that we use for the support, and also we have boxes that we use for different actors. The supervision grid as well that we have. These are the tools that we are using. These are essential tools that we use, and that allows us to be efficient. Thank you.
Merci beaucoup.
Thank you so much.
Monsieur Tiende, est-ce qu'il y a une autre main levée?
I see that there's another raise hand. No, we don't have questions anymore. We're good, thank you. Okay. No more questions. Maybe we should wrap up then and conclude. Maybe a synthesis before we conclude. So we saw the clinical aspect where there is a tutor and a tutoree, or mentor and mentee. So these are people in the same health formation where there is a skill test that is done at the beginning, and then the field that have been identified, that's family planning and post-abortion care for safety implementation of abortion. We talk about comprehensive care. In Burkina Faso, we need a different phrasing in French, but the idea is really to have 100% in that test. But if you have from between 90 and 99% in the skill score, then it's really good already. However, if you have below 90%, then you have to improve your skills and get a training to improve. We have seen the indicators in this area. We have a good improvement of these indicators, and we can really say that there's an innovative intervention that provides results. For decentralized supervision, well, we took the supervisees to the supervisors, and we use in this approach a supervision grid and also video recording that we analyze and where we give recommendations, and the performance score is 115%. We see, you already saw that this produces results. That is also confirming the satisfaction on the quality of these approaches. So, ladies and gentlemen, I thank everyone for your attention, for participating in this webinar. We are at your disposal. We are available if there are any questions after this webinar. We are ready to answer, of course. Thank you very much. I give you the floor.
Okay,
all right. Thank you so much. Thank you, dear moderator, for giving me the floor. Maybe before we conclude, officially conclude, I saw some messages in the chat that were asking for materials. So don't be reassured. We are going to share the materials on the link on YouTube where you can have access to the video, and also the presentations, the slide decks will be sent so that you can access to all the information that you need. Before we conclude, Pathfinder has another piece of good news in terms of this access to healthcare for sexual health and reproductive health. That's an example of environment that we created in Burkina Faso. There's a new webinar planned on the 28th of August. So that will be focused on the sexual rights, the sexual health and reproductive health access to the rights in terms of these two things. And there will be also partners who, of course, all Pathfinders will receive information about this webinar so that you can enroll in advance if you want to participate. So please feel free to enroll whenever you get the links, and don't hesitate to share on the networks around you so that everyone can have this information, whether on Facebook or WhatsApp. Please share as much as possible so that everyone can access to that webinar. It's going to be very interesting and we can all learn, I'm sure. To conclude, I would like to talk And on behalf of all pathfinders, a very big thank you for everyone and for all the participants for being here and for the presenters for their presentations. There was a lot of participants and we thank everyone for being here, taking the time. I know that even if there's one person online, sometimes there are 10 persons behind each person. So that's a lot of people interested and connected, and that's really, it's heartwarming and it's great to see so much motivation. I think really everyone at the Ministry of Health too, the support and the collaboration, and of course the Embassy of Netherlands that really is Netherlands, sorry, for their support. And I also want to take this opportunity to thank all these national associations that are supporting us. And I don't want to forget the global Pathfinder team, Yada, Samba, and Laura, who facilitated all the operational aspects of this webinar. So thank you so much. As you can see, it's a big teamwork, and that's because we're together that we can do it properly. So I thank everyone, and I really believe that we can move forward in a bright way all together. That's something that really goes to my heart. When I listen to the presentations, I see that there are great things happening, and I'm very grateful. I'm very thankful, and we will share the experience. We'll keep sharing the experiences, and we will give you the material. Thank you again, and see you very soon.
Peut-être que si les gens sont toujours là, je vais demander
maybe if everyone is still around, can we activate the videos so that we can see everyone online? So we can take a picture, a group picture. I think it would be great if you guys could. I mean, not everyone has the video, but please adjust your camera so we can see your face if you have a video, and enable your video. Thank you so much for showing your face. Thank you. It's great to see you. And everyone else, whoever can activate the video, thank you so much. Thank you. I can see your face. That's great. Thank you.
Monsieur Belém, Monsieur Suleiman.
I can see everyone's video. Oh, almost all the videos now. So we can take a picture for. This is our way to celebrate and as a family picture. And everyone else, of course, you can activate the video. Just for the speakers, I think it's important. And then we can have a screenshot.
Okay, c'est bon.
All right. Looks like it's well set.
Donc, merci à tous.
Well, thank you everyone again
pour la participation.
For participating.
Donc, la capture d'écran a déjà été faite. Donc,
the screenshot has been done. So thank you very much, everyone, and see you very soon for the next webinar. Thank you. Have a good night. Have a good day, and see you soon.